Hey you guys, I'm Dr. Sharma and I work at a hospital, which obviously means that we run the risk of being exposed to patients who could potentially have COVID or who actually are positive for COVID-19 infection. Since I was exposed at one point in time, I had to get checked. I was also having some symptoms as well, and they wanted to make sure that I wasn't positive so that I could potentially spread it around when I go back to the hospital to do more shifts. So I'm on the way to go get checked since I was exposed, and yeah, I guess we'll see what happens. They say it's a little bit uncomfortable doing the nasal swab. I'm just driving to the location. It's not exactly a drive up, but they allow me to park right outside, and then I can just walk up into the building. Of course, maintaining 6 feet, maintaining really good distancing between people, making sure we can't just spread this virus. And when you're inside, it's really not much talking. You're not supposed to talk much because you really don't want to spread around those respiratory droplets or anything like that. The testing kit is essentially a nasal swab that is placed into an inoculant and sent off to the lab. So as you can see, the testing facilities do want you to maintain that social distancing during the entire process because people who could potentially have the virus and be infected who are getting tested could absolutely spread around in that environment. You have to have a face mask or an N95 respiratory mask going into the building, and you have to maintain social distancing and actually not talk much. All the rooms and all the areas are cleaned up pretty well when you're inside the building, and after even you sit down, and you could have been testing negative, may not have even been sick, but despite that, they just have to be extremely sure that that's not being spread around. When they test it with a swab, it's kind of like a Q-tip, but kind of a long one. And randomly, I have a chopstick here. Don't ask me why I have that, but it's kind of not quite as long as this, but it's a pretty long, essentially Q-tip, or a swab is what we call it, that goes into your nasopharynx pretty far back and then touches the back side of the posterior nasopharynx and stays there. They have to give it a little nudge and twist. It has to stay there for at least 10 seconds. They do it for a brief second, not for as long as 10 seconds, but briefly on the other side as well, into the other nair. So both nairs in the posterior nasopharynx, as well as the oropharynx and back into your throat. So they'll take a quick swab there. So there's 3 areas that they swab in order for them to be sure that they got sufficient respiratory mucus in an area that the virus infects. So it's actually pretty deep, and it's kind of a little bit just uncomfortable very briefly, but it's pretty far back if you were to go stick this essentially back into your nose, and you can imagine the nasopharynx back there. And here is an axial slice of what that looks like. You can see that it goes all the way back and then goes back into the nasopharynx. And essentially the swab is taken from there for a sufficient sample. It takes between 24 to 48 hours to get your tests back, and that's essentially it. The testing center that I went to was not a drive-through. It was you essentially park outside and go through it. There are drive-throughs that have opened up, and they are also doing the nasal swab tests. As always, continue to social distance, be safe, and practice safe hygiene.